In this video, we're going to discuss public health ethics in light of the coronavirus. In particular, we're going to look at 5 justificatory factors that can warrant overriding things like individual autonomy and freedom of movement in situations like this. But we're going to still critically examine the case to see what we come up with regard to coronavirus. So I hope this is helpful for you and gives you sort of a break from the news, lets you think philosophically about what's going on. Welcome to the Philosophical Life. I would be remiss if I didn't do a quick public service announcement because we are in the start in the United States of the virus spreading. So as the Google website talked about in relation to the World Health Organization, do the 5 to help stop coronavirus. That is hands, wash them often, elbows, cough into it. Face, don't touch it. Feet, stay more than 3 feet apart. And then if you're feeling sick, stay home. Of course, there's a shelter-in-place order in many places around the country, so please obey that and just leave if necessary. Okay, with that public service announcement out of the way, let's get down to business. So, there are restrictions on autonomy, and in light of coronavirus, the public health goal, you might say, is to flatten the curve. That is, initially, to slow the spread of the virus so that the public health system can actually absorb all the patients. Nations, as you probably know, are going into lockdown. Italy, of course, China did it early. Events are being canceled right and left. Schools are closed. Quarantines are being mandated through governmental or social pressure. Travel is being restricted. And as I mentioned before, now there's a requirement to shelter in places like California, New York, and some other states across the nation, and probably more are soon to follow. So that is a restriction on freedom of movement. Now, the key question becomes, as it says there, when can paternalistic interventions, paternalistic you can think of as like a parent figure telling a child to do something. The child is sort of helpless to a certain degree, doesn't know what's best, so the parental figure will come in and say, this is what you ought to do. And paternalistic treatment, when it comes to treating adults that way, they have to be justified. Why? Because fully functioning adults have certain rights and abilities that must be respected, or at least can't be overridden, ethically speaking, without some sort of justification. So as it says there, when can paternalistic interventions by the state or other authorities be ethically justified if they infringe on general moral considerations such as respect for autonomy, freedom of movement, self-determination, including liberty of action, the ability to go where you want to go within reason, within what's legal, and do what you want to do? Well, there are severe restrictions on that being put in place. Now, it depends. So when is that justified? Well, it depends whether promoting public health warrants overriding such values as individual liberty, freedom, or justice. Now, here are some of the goals for this discussion. We're going to use this paper by Childress et al. And as you can see in the slide there, I've given you a snapshot of the first page. And that's the paper, and it does a good job of mapping out public health ethics. This is a good time to learn what is public health ethics. Well, first we're going to define public health. We're going to identify the moral factors. 3, we're going to comprehend 5 justificatory conditions that can override or resolve conflicts when there are conflicts among moral factors. And then lastly, we're going to apply this to coronavirus in sort of a tentative fashion, just sort of brainstorming out loud and trying to figure out how can we run through these 5 factors and figure if public health warrants overriding individual liberties in this case. Now, let's go ahead and start by defining public health. What is public health? Well, as Childress et al. Say, it's basically all the people and actions, including laws, policies, practices, and activities that have the primary purpose of protecting and improving the health of the public. So you can think of it, public health ethics, as sort of a system of different agencies and entities that are all working toward the common goal of promoting health in the public. Now, what are the moral factors that public health aims to secure? So why does public health exist? And what sort of morally relevant factors are trying to be secured through the practice and the policies of public health? Well, number one, they're trying to just produce benefits in society to increase and leverage health outcomes, trying to avoid, prevent, and remove harms. So you have producing benefits and removing harms as two goals. Trying to also produce the maximal balance of benefits over harms, and that's often called utility. Here you can think about the moral principle of utility, which says that the right thing to do in any case is to maximize the greatest amount of benefit less the amount of harm that's going to be caused by a particular action for all those that'll be impacted by it. So producing utility is another important moral consideration of public health. Distributing those benefits fairly, this is often called distributive justice. So it's a question of how the benefits and burdens are distributed across the public population. And you want to do it fairly. That is, you don't want to disadvantage, say, those that are worse off in the society and give them an extra dose of the burdens. So you're trying to create this balance. Also, you're going to respect autonomous choices. So people are individual agents. They have a mind, they have a will, and they can make decisions for themselves. And you do need to respect that ability to make autonomous choices, including liberty of action. So freedom to move and do things. You need to protect privacy and confidentiality. Keep promises and commitments is another goal of public health. Disclosing information as well as speaking honestly and truthfully. And sometimes that's grouped under transparency. So you want to be honest about what you're doing with regard to public health and be transparent. And then lastly, building and maintaining trust. Now, oftentimes there can be conflicts, though, in a particular case where you're considering a policy or an action on how it'll impact the public. There can be conflicts between the morally relevant factors, and we'll get into some examples of that. So there are 5 justificatory conditions that will help you to resolve those conflicts between the moral considerations we just talked about that public health is trying to secure. They can't secure all of them because there's a conflict. Then how do you prioritize? And how do you figure out what is the right thing to do, morally speaking, in a particular case, given that you can't satisfy all the moral requirements that you're seeking to satisfy? So they are, and we'll go through them individually, but they're effectiveness, proportionality, necessity, least infringement, and public justification. What is effectiveness? So effectiveness, it's essential to show that violating a moral consideration will likely promote public health. So you have to show that this particular policy or course of action will promote, likely, probably, public health, even though it's going to violate a moral consideration were it enacted and carried out. For instance, as it says in the slide, if restricting freedom of movement were not positively correlated with flattening the curve of the rate of the spread of the coronavirus, then these shelter-in-place mandates would be ethically unjustified. Essentially, unless they're shown to be, shelter-in-place is shown to be effective or likely to flatten the curve and slow the spread of the virus, then having people shelter in place, violating massively their autonomy by forcing them or mandating them to stay indoors and not leave their home, that would be ethically unjustified. Also, you have proportionality. So the probable public health benefits need to be shown to outweigh the infringed general moral considerations. For instance, as it says there, breach of autonomy by requiring quarantine. So you might have seen cases where people either were around people who were infected or they themselves were infected, and then they have to quarantine themselves for at least 14 days to prevent from spreading it to others. Now, requiring quarantine for those exposed to someone with the virus, or if they have it themselves, would be ethically unjustified if the negative results of sheltering in place by quarantine would result in people get lonely when they're just stuck by themselves or isolated. They also get like a cabin fever type thing. We've been sheltering in place for a while, starting to feel a little of that, a little itchy. But there's more serious mental health impacts that occur when people are isolated. And so enforcing quarantine is that proportional, or the benefits of enforcing quarantine in terms of stopping them from they're contagious, further impacting and spreading the virus? Would that outweigh the benefit, the things that are likely infringed? That is obviously freedom of movement, but also these mental health factors that go into being a fully functioning, well-functioning person. So we need to know that it's proportional, that this particular course of action will outweigh the negative. Necessity. So not all effective and proportionate policies are necessary to achieve the public health goal. Here's an example in this quote from Childress et al. For instance, a policy that provides incentives for persons with tuberculosis to complete their treatment until cured, so you incentivize them to complete treatment, will have priority over a policy that forcibly detains such persons in order to ensure the completion of treatment. Proponents of the forcible strategy have the burden of moral proof. So we're going to need to weigh this and figure out, is this policy necessary? Is it necessary to forcibly detain people to ensure they complete their tuberculosis treatment? If there's an alternative, that will also work. And even if it doesn't work quite as strongly as forcible detainment, at least if it's in the range of what's an acceptable tolerance range for it working effectively, then it's not necessary, even though it would be effective and proportionate. Now, least infringement. So even if you have an effective, proportionate, and essential policy for realizing a public health goal, you should still try to minimize the infringing of moral considerations. And here's another quote from Childress. For instance, when a policy infringes autonomy, public health agents should seek the least restrictive alternative when it infringes privacy. They should seek the least intrusive alternative. So the goal here is, once you've shown that a policy is going to be effective, proportionate, and essential for realizing the public health goal, then you need to still try to implement it in a way that minimizes infringement of those moral considerations. So minimizes infringement on autonomy, for instance. Public justification is basically the idea that a policy for promoting public health needs to be justified to the public, or at least justifiable in principle to the public. And as the quote from Childress et al. Says, this transparency stems in part from the requirement to treat citizens as equals with respect to offering moral reasons. So you want to respect people's intelligence and their ability to weigh and consider moral reasons, and you need to do that in an equal and fair way. And by requiring public justification, you're in essence, you're respecting that part of people, which in principle they could find acceptable for policies that infringe general moral considerations essential to creating and maintaining public trust. And it is crucial to establish accountability. Now, let's take this through an example involving pregnant women. So this is a screening program example that Childress gives. So, as it says here, suppose public health agents are considering whether to implement a screening program for HIV infection, tuberculosis, another infectious or contagious disease, or a genetic condition. Now, the challenge is that different screening programs might fail in light of those 5 justificatory factors that we considered earlier. And here's a for instance given by Childress et al. Neither mandatory nor voluntary universal screening for HIV infection can meet these conditions in the society as a whole. So you need some sort of reason to screen people for this sort of private information about HIV, tuberculosis, and other infectious and contagious diseases, or even a genetic condition. And mandatory nor universal screening can meet that for society as a whole. So let's take a look at this. Well, how did they handle this? So this actually occurred and was wrestled with. So screening for pregnant women for HIV, there was a mandatory screening was called for by some in public health. So some in public health thought that screening, it would be mandatory for all women to have this screening done who were pregnant. Such screening was initially shot down, though, as involving unjustifiable violations of autonomy, privacy, and justice. So that initial policy approach to HIV screening of pregnant women was shot down. In place of it, though, and you might say, well, what are the conflicts here, the moral considerations? Well, you have, for instance, as it says here, you have utility plus efficiency. So utility, maximizing benefits over burdens. Efficiency, how efficient it will be. That actually favors mandatory screening in high-risk communities. So instead of screening all pregnant women, you identify where it's going to be most efficient and effective to screen, and namely, it's in high-risk communities. And that, by doing that, that will also maximize benefits over burdens. Alternatively, you have liberty, privacy, and justice, moral considerations, and those considerations instead favor voluntary universal screening. So you can see you have conflicting moral considerations that pull in 2 different directions with regard to the correct course of action for promoting public health. Now, what about coronavirus and shelter in place? Let's apply those 5 justificatory conditions to consider what's being mandated in California, New York, and so on at different places across the country, namely that you just need to stay home and you can only leave to do essential activities such as go shopping, medical appointments, and bare minimum essential. They're still working out what essential means, but just any sort of essential function, you got to go do it and then get back home, which obviously is a huge violation of autonomy. So now here's the question. Does shelter in place effectively, so here we're considering how effective is shelter in place as a policy for promoting public health? Does it effectively flatten the curve? We've heard about that in the news a ton. We need to flatten the curve. The CDC, as the CDC put out in this infographic, we want to flatten the curve of the spread of the virus and the system's capacity, the healthcare system's capacity to handle the spread of the virus across the globe, essentially. So here's, as you can see there, basically without protective measures, if there's just no violations of autonomy, people aren't asked to shelter in place, then there's going to be a huge spike early of cases. And the idea is that will overrun and overwhelm the healthcare system and create even more problems for the spread of the virus because the healthcare system is going to be playing catch up to try to catch up to the spread of the disease, the rate at which it's spreading in that particular population. So if we actually do shelter in place, the idea is that mandated shelter in place, stay home, slows the rate of transmission, the spread of the disease throughout the population, and the healthcare system can then stay on top of the disease and handle the cases as they come up. Now, it's not entirely the case. As you may know, there's a shortage right now of the important masks, the N95 masks that are used by healthcare providers when they're actually screening patients for the virus. So there are, even with shelter in place, there are gaps in our ability, the ability of the healthcare system to keep up with administering tests, having tests, administering tests, properly administering tests, and so on. But if there wasn't a shelter-in-place mandate in place, then for sure the spread of the virus would be outstripping the capacity of the healthcare system to handle the virus as it's spreading right now. So I would say shelter-in-place, at least on the face of it, is an effective way of promoting that public health goal, which is to flatten the curve of the spread of coronavirus. Now, what about necessity? Is shelter in place necessary to flatten the curve? Is it essential to realize that goal? And you might remember with necessity, you want to consider relevant alternatives. Like, here's the question: would a social distancing policy, so initially that was the policy that I'm in California, that was given just, hey, stay sort of arm's length or more away from people as you're out and about. Don't go carousing and hanging out with a bunch of people. You don't have to stay in your home, but just use common sense and don't sort of, snuggle up next to some person and they cough in your face and you get it. Now, that's less of a violation of autonomy. People can still go out. They aren't forced to stay in their home. But so would that policy work? Would it work and be as effective as a shelter-in-place policy to achieve that same goal of flattening the curve? If yes, if social distancing would roughly be as effective as shelter-in-place, then shelter-in-place isn't a necessary condition for meeting that public health goal. Now, that's an open question. What do you think? I think actually probably forcing people to shelter in place is more effective than social distancing, because when people are out in public, they're still touching stuff, they're still coughing, and the virus, as my wife, who's in healthcare, has told me, this is a very hardy virus. So if somebody coughs on a railing or a door handle or something like that, it can survive for up to a couple hours on that surface, and then somebody comes along and touches it and then touches their face and so on. So it does seem, given the nature of the coronavirus, COVID-19, that it is necessary to force people to shelter in place as opposed to just a policy of social distancing. It wouldn't be nearly as effective at flattening the curve of the spread of the virus. What about proportionality? Well, will likely benefits of shelter in place outweigh the unequal distribution of burdens, and this is a serious one to consider, of not being able to go to work and have kids in school. Now, families that are well below the poverty line are going to be hit hardest by shelter in place and by school closures and so on, due to loss of wages, due to kids not being able to get square meals because maybe there was already food scarcity in the home. And then instead of kids being able to go to school and get fed, they now are at home and probably eating through everything that was there, which was already scarce. Where will children get meals? And so when you think about proportionality, how is shelter in place going to impact the different people across the economic spectrum? And it does seem like the least well off, those that are well below the poverty line, are going to be hit the hardest by shelter in place and by not being able to go to work, by not being able to have their kids in school and so on. So it seems like shelter in place fails to meet the proportionality requirement, at least as we characterized it. And I'd be curious to hear what you think. Leave your thoughts in the comments down below. Do you think that's right? Or do you think there's another way of thinking about that would change that? Now, what about least infringement? Does shelter in place realize the least infringement possible or consistent with realizing the goal of flattening the curve? So I think the best response to give right now is that we need to wait and see. We need to see actually how the government has made its decision to implement shelter in place to realize flattening the curve. And until we get that information, it's sort of hard to know, did the government consider all of their options? Again, I sort of speculated that given that the United States was hit after China and Italy, we did have those examples to go from, but how did the government do in considering all the factors? And did they really implement the strategy with the least infringement? It's quite possible that shelter in place was necessary, proportionate, and so on, but it did fail the least infringement condition for justifying shelter in place to achieve that public goal. Why? Because it's a huge infringement of autonomy, right? But we don't know that. I don't think at this point, if we're being intellectually honest, I don't think we can make that determination. But again, I hope this is instructive to show you how you have to figure out and think through these public health policies and different options for realizing those goals when they infringe on moral considerations. And I hope that's been a helpful video. If you stuck around till now, I'm giving you extra props. And I just want to wish you well wishes. I hope you're doing well in health, and I hope you're making great decisions in terms of slowing the spread of coronavirus. Please let me know if you have any questions or comments in the comment section. Give the video a thumbs up and give it a share and a subscribe to the channel if you found this helpful and you'd like to get further ethics videos as I release them. And as always, keep thinking ethically and living wisely. That is, keep living the philosophical life. I'll see you next time.